Well, I chose you. Plenty of referrals, friends and family that had previously had their surgeries done by you and looked amazing.
Thank you.
Obviously, when I came in for the consult, you were just so warm and welcoming. It was never about like the dollar amount or anything. I mean, there was things that I thought I needed where you said you don't really need that. So it was really just, making me feel comfortable like it wasn't a dollar amount. And also I had seen the work that you had done. So yeah, it was an easy choice for me.
Thank you. Thanks.
Course.
Yeah, I mean, I think that's one of the things that I believe is so important in this. This is, of course, these procedures are super expensive and they require a lot of investment on your part and time and energy and just emotional and physical downtime. But, I think that just, it's so important for me to, and our staff to convey like a comfortable place for you to be in. Well, I'm glad that was at least, and I guess maybe talk about your experience afterwards. I know it wasn't as easy as it was for maybe some of your other family members and friends that did it, but I guess share.
Okay.
You can be open.
Okay.
Yeah.
I've never really had any like intense surgeries before, so the expectation, I didn't really know what it would be.
What to expect,
and I don't have a high pain tolerance, but honestly, it was pretty easy after the first day or two, and it wasn't more like I was in pain, it was just uncomfortable. More like the stitching and just the stiffness. But after that, it was pretty easy. I mean, it was, just changing the bandages as needed and icing was pretty obviously all throughout the day and stuff. But other than that, I would say that there was not a lot of pain. Just some discomfort early on.
And then what procedures did you have done? Remind us.
I had the upper blepharoplasty. I had a lot of loose skin on the upper eyelids. It was bothering me. And then I had a neck lift.
Nice neck lift.
I had gone kind of up and down with weight and I just lost, I think, a lot of elasticity in the neck and it was kind of hanging. And it just, I didn't like it. It was not making me feel great about myself. So so the neck lift and the upper blepharoplasty.
As far as things that you'd like to share for other patients out there, if they're coming up with ideas or have decisions or, these are big decisions. Like how do you help, if you were to help someone, you're sitting down with a friend, how would you help them make a decision of who to pick, what procedures, all of those different types?
Well, I think as far as like who to pick is absolutely somebody who, as soon as you walk in, makes you feel welcome and comfortable, not feeling like they're telling you need more things than when you came in for that you thought you needed. And like I said, I just felt very comfortable. I had had a few consultations prior to you and I did not feel the way I did when I walked in here. So
that's very sweet.
First and foremost, just somebody that you feel comfortable with, that has your best interest at heart. As far as procedure, I mean, I knew it was going to make me feel better about myself to have, especially the neck lift done. So I think make an investment for yourself. I think, if it's something you want to do it. The recovery wasn't horrible. So do it. That's all I have to say. If it's going to make you feel better about yourself, do it.
That's awesome. Well, thank you.
Of course.
Appreciate it.
Of course.
Nice to see you.
You too.